For the first time in almost a year, new coronavirus cases fell below 30,000 a day in the United States, and at least 39 states have seen their case counts improve over the past week. Large cities are beginning to reopen. Right here in New York City, it lifted its capacity limitations at bars, restaurants, gyms, and churches. More than 277 million Americans have gotten the vaccine so far. The CDC says nearly 40% of the country is now vaccinated. We're joined now by Dr. Amesh Adalja. He is an infectious disease expert and senior scholar at the Johns Hopkins University Bloomberg School of Public Health. Doctor, thank you so much for being with us. New York City is reopening. Mayor Bill de Blasio said he wants the city fully reopened by July, but despite some new mask guidelines by the CDC, masks are still mandatory on public transit, in schools, homeless shelters, nursing homes, and some other healthcare settings. There was an interesting question that was raised yesterday by a member of the Senate, which is, why are you allowed to be maskless now in New York City in a restaurant or in a bar or in a gym, but you can't be maskless on a subway? Help us understand that.
Well, what you're likely seeing is the mask guidance kind of being removed in a cautious manner. And we know that when people are packed together in these kind of transit locations, like being on a subway, there's not really a way to know who's vaccinated, who's not vaccinated. So I think from an operational standpoint in public transportation, it makes sense to continue to have people universally wear masks until we get more control of the virus in the community, more people vaccinated. I think this is eventually going to go away, but I think logistically it's very hard to be able to distinguish in that type of setting, and especially because we know that those are indoor settings where people are crammed together and there is a high risk of transmission if there is an infected person that might be pressed subway, for example.
So then you have Texas Governor Greg Abbott. On the flip side, he has been very firm about mask mandates. He doesn't like it. He's threatening a $1,000 fine for any government entity that is actually requiring people to wear masks. So you're punished if you ask someone to wear a mask. I think this is probably just adding to the confusion about mask wearing and where we can't and where we can. And I think people have to be reminded that, when it comes to how you approach this virus, there are so many different factors, which is why you can't have a one-size-fits-all approach. In some environments, there are people who are immunocompromised. So it means that we need to take extra precautions. In other environments, the virus is super low, and so maybe you can be a little more loose with the requirements. So I want to ask you, what advice do you give your patients about when and where to wear a mask?
So I tell people if they're fully vaccinated, they can go back to their pre-pandemic life, that they're not going to be someone who spreads the infection or someone who is at high risk for contracting the infection. However, some people have different risk tolerances and they may still not feel comfortable taking their mask off. I think that's fine. I tell them that you have a lot of room here. If you want to take your mask off, go ahead and do that. But if you don't feel comfortable, don't do that. And I think we need flexibility because people are on different time scales. They've been scared through a pandemic for over 14 months where there has been a lot of conflicting guidance, a lot of conflicting science. It's hard for them to understand. So it may take time. And you have to remember that people also got used to wearing masks and none of them got common colds. None of them got influenza. So we may see people who want to wear masks just as a general hygienic measure, the way we see in some Asian countries, because they don't want to get the common cold or they don't want to get influenza. And I think that's not a bad thing if people want to do it. I think we're going to get to a point where you start to see a lot of these public health guidance loosen, but there's going to be some people who picked up this habit and are going to stick with it. And I think that's completely fine. And I don't think that if you're, for example, trying to have in-person schooling where you have some swath of the population that's not able to be vaccinated, meaning kids under the age of 12, and you're doing these extracurricular activities. And I think if you have kind of these thresholds where people are shutting schools down for a very small number of cases, I think having masks in place for some of the school activities, especially ones where social distancing isn't applicable until you have enough of the students vaccinated, is probably going to be a way to keep schools open. So I think we want flexibility. We don't want the government to kind of go back the other way and punish people for wearing masks, because they have found some value, not just with COVID, but with other respiratory infections as well.
Doctor, the EU has agreed to open doors to some vaccinated travelers as more restrictions ease and travel becomes more extensive. What advice would you have for those who are looking to get away?
I would say go for it. If you're fully vaccinated, like I said before, you're not going to be someone who's spreading the infection or at risk for contracting the infection. So go back to your pre-pandemic life as possible. And hopefully more countries will do what the EU has done and open up to fully vaccinated travelers, including even our neighbor to the north, Canada, where the border has been closed for some time now.
Meanwhile, Pfizer has announced a booster shot may be needed within 8 to 12 months. Could vaccine hesitancy become an even bigger issue for people if they have to start considering perhaps a third shot? You're an infectious disease expert. What's your take on this?
I think it's premature to say that we're going to for sure need a booster shot in 8 to 12 months. I don't think we have all of that data yet. To me, the threshold for a booster is fully vaccinated people getting infected to a point where they're landing in the hospital again, and we're just not seeing that. So I know that there are companies like Pfizer that are doing studies, and it's important to do those studies. But I don't think we've crossed the threshold, because we don't want to just give people boosters unless they're actually needed, especially when we're trying to get vaccine into the arms of the world's population. And if we're giving third doses to Americans who may not even need them, I don't necessarily think that that's the best strategic policy to control this pandemic.
Meanwhile, there's a new study out of the Stanford University School of Medicine that found that healthcare providers may be overcounting the number of kids hospitalized for COVID-19. Break the study down for us.
So what you have to remember is that when you get admitted to the hospital in the middle of this pandemic, everybody is getting tested for COVID-19, just almost like a universal screening program. So many kids that were counted as COVID-19 hospitalizations were hospitalized for some other reason and happened to test positive. So that really doesn't give you a full picture of the burden of hospitalizations of children. It actually overstates it. And that's important because when you looked at what happened with schools and other children's activities, the teachers union seized on some of those numbers and then used that as an excuse to keep schools closed. So I think this is something that really did damage to children. And I think this study is illuminating because it shows that you really have to be able to look at the data objectively to understand what actually is happening. And it is true that children are generally spared from the severe consequences of COVID-19, and they're not spreaders of infection in the community the way they are with influenza. So that's why many activities are safe with children, and it's going to become even more safe as children are more and more children are becoming eligible for vaccination.
All right, Dr. Amesh Adalja, thank you so much.
Thank you.